Okay, in this one here we're showing the middle cervical placement. So this is where you would put it for middle to lower. This placement is directly underneath the earlobe as your landmark when you're placing it. Your head should be fairly looking straight up towards the ceiling, doing for the recommended time that we told you. For the cervical Denneroll, please make sure that when you roll off to the side, you pause and just wait. Make sure you're not dizzy or lightheaded or any tingling or numbness shows up, and then you sit yourself up when you're comfortable. That is the middle placement, and here is a close-up of it. So slightly with the earlobe, and then just comfortably relaxing on it for the time frames that you can do comfortable. Now on this one here, this is for your lower cervical placement. So this one will be tucked further down, pretty much flush to your shoulders. You can see it's well below the earlobe, actually kind of more in line with the chin. And here the head is extended back. Same thing when you go to get up off of this one. Just make sure everything is okay, that you don't get dizzy or lightheaded, and make sure no tingling is in your arms before you come up out of that placement. This is just a close-up of it, so you can see how it's nestled down below the shoulders there, and nice and comfortably relaxing.